Hi everyone, welcome back to the channel. My name is Ashish and I'm a junior doctor working in the UK. Today's video will be about general practice training in the UK and how you can apply for it. So let's start talking about it. To become an independently practicing GP in the UK, you'll have to undertake at least 3 years of training. And this is at least because you can go for further training to become GP with special interests, and these special interests can be in different medical fields including cardiology, they can include A&E and a lot of other things. So it is at least 3 years of training to become a GP in the UK. So the general practice training consists of 18 months in general practice surgery. Surgery is just a fancy name for clinics, and then you'll have to train further 18 months in hospital posts, and this is 12 months in hospital posts in Wales. During this training you'll have to complete different kinds of workplace based assessments, which will include mini-KEXs, DOPs, CBDs, and mini-KEXs are mini clinical evaluation exercises where you'll be supervised by your assessor and you'll have to take a focused history and do an examination on a patient, and then the assessor will see how you did and they'll review your performance, and then you'll have to write a reflection on that. DOPS is directly observed procedural skills, where one of the consultants will see you doing a procedure and then they'll review that. And CBDs are case-based discussions where you'll take a history from a patient and then you'll discuss it with the person who is going to supervise you in that CBD, and then you'll have a discussion and then you'll write reviews on that and reflections on that. During this GP training you'll have to pass 2 exams. The first one is a theoretical exam, and this is applied knowledge test or AKT, and you can appear in this in the second year of GP training. And the second one is clinical skills assessment test, which is CSA, and you'll have to appear in this exam in the third year of GP training, and this is more of like a OSCE kind of exam like PLAB 2. After successful completion of these exams and all your workplace based assessments, you will be offered a certificate of completion of training, which is CCT, and you will get the membership of the Royal College of General Practitioners. This means that you can finally practice as a general practitioner in the UK. Let's talk about the pros of GP training. The first one is that it is less competitive to get in, and the competition ratio for GP training is 1, which means that for every candidate who applies, there is 1 GP training post available in the country. This is very good in comparison to other specialties like general surgery or radiology. The second one is short duration of training. The training is just for 3 years and then you're done. The next one is the ability to choose working hours, and by this you can work as a full-time GP in a general practice surgery, or you can become a locum GP, or you can become a part-time GP. The next one is less exams. There are just 2 exams to become a GP in the UK, and this is very different in comparison to medicine or surgery, where you have to go for multiple membership exams and then fellowship exams to become a consultant. The next one is ability to choose your work and take additional responsibilities. So as a GP you can be quite dynamic and you can take up different kind of responsibilities. You can become an educator, you can work as a cosmetic doctor, you can train further with special interests in different kind of fields. So the job is very dynamic. The next one is earning potential. So you can function as a businessman and you can open up your own general practice surgery. So the earning potential is quite high. The next one is the freedom to move to other countries. So a lot of Middle East countries, Australia, New Zealand, and a lot of other countries like Canada, they are all open to accept GPs who have trained in the UK. Let's talk about the cons of GP training. The first one is limited resources. So you have a limited time to assess a patient in a GP surgery, and this is around 8 to 10 minutes, and you are not able to order a lot of investigations which you might have done in a hospital based setting. So it can be a bit challenging with these limited resources to reach a proper diagnosis and plan a proper management for patients. The second one is overwork. So because of few numbers of GPs available in bigger cities and because of the huge population, GPs might have to work a lot harder, and this can lead to poor work-life balance. The next one is that the GP degree is not recognized in the home country of a lot of doctors, and this is particularly true for Pakistan and India. So you can't go back to your home country because there is no concept of GP available there. So how to get into a GP training post? To get into a GP training pathway, you will either have to have completed the official foundation program, and you should have a foundation competency certificate which you get after completing this program, or you can get a CREST form signed by a consultant with whom you have worked with in the last 3 months, and this is the most common pathway for most IMGs. The applications usually open in 3 rounds. So the round 1 usually opens up in October. The next round is round 1 re-advert, which usually opens up in February, and the next round, which is round 2, opens up in July. So you have 3 rounds of application and you can go for any one of them, although it's best to apply in round 1 because you have the most number of seats available there. All the applications for GP training are made through Oriel, and Oriel is a common website on which you can apply for any kind of training pathway. So when you go to Oriel, you'll have to find the training post, which is GP specialty training post, and you'll have to submit your application along with the CREST form and the ALS certificate, which says that you have passed ALS. And in this application, you will be asked to rank your preferences of locations where you would want to train from. After submission of your application and the document check, you will be called to appear for MSRA, which is Multi-Specialty Recruitment Assessment. This is a multiple choice exam and it consists of professional dilemma questions and clinical questions. And mind that professional dilemma questions have a higher weightage. And once you go through this exam, you will get the score in about 3 to 4 weeks, and the highest scorers in this exams, which is the top 10%, get direct offer to GP training. Others who are not able to score in the top 10%, they go through the last step of the assessment, which is GPST Selection Center or GP Specialty Training Selection Center or Stage 3 assessment. This consists of simulated consultation between a patient or relative or colleague and a written prioritization exercise. And your scores in this will decide whether you will get a post or not, and what preferences you will be able to choose according to the local competition, and the scores will decide that. So that is all for this video, and I hope that this video helped you in getting an idea of how GP training works in the UK. If you want to support my work on YouTube, you can do so by clicking on the like button. You can share this with your friends and you can subscribe to this channel. And I'll see you soon in another video. Thanks for watching.